A great good morning to you, Dr. Tam. How's it going?
Good morning. How are you today?
Real well. Thank you very much. Really appreciate you joining us this morning as well. It's been a couple months since we've chatted, and a lot has happened with the pandemic and in our area as well. So if you don't mind, let's just start off by you giving us a little bit of an update on the coronavirus pandemic and how it is affecting Delawareans, especially here in Sussex County.
You know, I think, Jeff, when you said that it's been a couple months, I think it was about March or early April.
Oh, wow.
We talked.
Okay.
But, you know, it's interesting to tell you, and it's a little bit concerning, that we are pretty much in a nearly similar place in terms of numbers as we were back when you and I talked. You know, our Sussex County, especially, our positivity rates are going up, and Sussex, Delaware itself, the numbers are going up in terms of the number of positive tests going on every single day. And, of course, nationally, there are many states that have an increase in the number of tests that are positive and hospitalization. So in some respects, things are similar in terms of numbers, not necessarily similar in terms of the situation of where we are in terms of fighting the pandemic.
Very true. And, you know, our numbers dipped, and as you mentioned, they are on the rise again. Do you think that you and Beebe Healthcare can look back on the spring and summer, and do you think that that has helped maybe better prepare you for the fall and winter?
Oh, absolutely. I mean, Beebe Healthcare is much more prepared, as well as most other health systems in Delaware and throughout the country. There are a couple reasons. Number one, you know, when we started with the pandemic, we didn't know about what the pandemic, what coronavirus was capable of doing, all the different ways to treat. You know, one of the things that happened early on in the pandemic, when people came in with respiratory symptoms, they were automatically, of course, after clinical evaluation, put on ventilators, because that's what you do when you treat people with severe respiratory compromise. That said, it turned out that in many of the cases, patients did not do any better on a ventilator versus other kinds of respiratory support, like something called vapotherm, which is a sort of a halfway ventilation system. And so we've learned a lot about how to better treat patients. We now have medications like remdesivir, like Decadron, that have actually been shown to have benefit, you know, in international research. And so there are a lot of things that we do now in terms of treatment, and we also know a lot more about how to contain and protect our teams, our staff, our patients in the hospital.
And you mentioned rising numbers, and we talk about the numbers every day. We talk about the importance of getting tested as well, whether you have symptoms or you don't have symptoms. What would you attribute the rising numbers to and the increase in hospitalizations to today?
Well, I think they're not necessarily the same. I think the rise in hospitalizations, a lot of it is a result of an outbreak or an increase in cases in skilled nursing facilities and long-term care facilities, because it is the older population that is more at risk, right? Everybody can potentially get infected, whatever your age. It's the older population or the ones who have health care issues who are the ones more likely to get sick and have to be hospitalized if you're infected. That said, there are now younger people being admitted to the hospital with the need to get medical support, and that's concerning. With respect to the number of tests, the number of testing is not the number of tests that are positive is also of concern, and there are several factors. In fact, the Division of Public Health's website, you know, at the very bottom of the website, even has now a location factor in it, and it talks about things like restaurants, gyms, house parties, weddings, things like that. And at the end of the day, the reason why I think these numbers are up in terms of testing is because people are gathering more in larger groups. And, of course, I think we call it here at Beebe, but I think it's spread across the country, COVID fatigue or pandemic fatigue. You know, we did have some couple weeks where things were looking really good, and I think that all of us, all of us, and I mean myself included, felt that things were better and maybe let our discipline slip, walking around with our masks, on our ears or our noses not covered or things like that, maybe gathering in larger crowds, maybe not washing our hands. And I think that together with the larger crowds has caused this increase in testing.
How are the hospitalization numbers at Beebe as far as capacity and the amount of beds that are filled now?
Well, we don't usually tell people how many actual patients are in the hospital with COVID-19, but I can share with you that 2 weeks ago we were down to about 0 to 2 patients with COVID in the hospital. And that was in the past. Today, that number is in the double digits. And so, we've seen a fairly high rate of increase in the number of hospitalized patients, and that has us concerned. As far as capacity goes, because we spent so much time in the early part of the pandemic working on our ability to expand our capacity, we have the capability to go even further. And so we're fairly confident because of what we were able to do in the past to know what we are capable of doing today and in the future. And so I want the community to know that Beebe Healthcare is prepared and is ready to take on even more as we continue to encourage people to not get infected and take care of themselves.
As far as PPE, the personal protective equipment, how do you believe Beebe stands now to get us through this first wave and in case there might be a second wave?
Well, part of being the job of a CEO is to balance pessimism with optimism, or as we say in the Navy, plan for the worst, hope for the best. So what we did do was make sure that when we had the opportunity, when there was a lull, we stockpiled more and more PPE. We've also had the practices identified of how to expand the utilization of our PPE, how to make sure that we cohort patients into certain areas so that PPE can be used in a much more judicious manner. And so we have PPE. The question will be just how bad the second phase or the second surge will be. Right? And so right now we are capable of maintaining how we are, and even as we move forward and get more COVID patients, and even continue to do our regular work of surgeries and other procedures. And we'll just have to see how bad this gets.
Sure, and then of course you have to factor in the flu. I see you've got a video up on bbhealthcare.org of you getting your flu shot, and we saw a week or so ago Governor John Carney in a press briefing getting his shot as well, and the two of us here in studio have already got our flu vaccine.
Yeah, I'm going to just say that the reason for that, people keep saying, well, why do we need to get the flu vaccine? And the answer is not because the flu vaccine will stop you from getting COVID, but what the flu vaccine will do is prevent you from getting the flu. And if you don't get the flu, I'll take it the other way. If you get the flu and you're sick, you have symptoms, you have respiratory symptoms, you have a fever, you don't feel well, that's just one more risk factor of, if you end up also getting COVID, of being in a sick enough place that you end up in the hospital. We've talked about comorbidities like diabetes, high blood pressure, congestive heart failure, heart disease, all those things that make you more at risk for, if you get COVID, if you're infected with coronavirus, you'll end up in the hospital with COVID-19. And that's what flu is. It's just another comorbidity that you can avoid by getting a flu shot.
And would you say that there is a shortage of the flu vaccine? I know that more people are getting the flu vaccine here in the first state. In fact, you had to cancel a couple of Beebe's flu clinics waiting for the vaccine delivery. And you did a Facebook Live, if I remember correctly, Saturday, letting people know you've been there since 8 and it was just 11 and you were almost out of the vaccines.
Yeah, so as you know, there are two types of flu vaccine: the regular dose and the high dose. And the high dose is the one for over 65 and potentially people with other medical complications that place them at higher risk. And so, first, you are absolutely right. More and more people are taking the flu vaccine, which is great. I don't know if you know this, but actually we put in our orders for flu vaccine over about a year ago.
Oh, no. Okay.
And that's how it usually works, because then people manufacture, the manufacturers make the flu vaccine over a series of months, and then there's a distribution process. So the flu vaccine that's being given now is not being made anymore. In fact, everybody's turning to other kinds of vaccines, including, of course, people thinking about how to make the coronavirus vaccine. So, when we get our vaccine doses, it's because of orders that were made even before the pandemic was even going on. And so we ask people to make sure that they get their flu vaccines. Ours are, of course, free, which is why they are very popular.
Sure.
People want to come to them, versus going to a retail store where they have to pay. So what I'm going to ask people is to go to bbhealthcare.org, because on that website, on our main website, there's one banner that says screenings and clinics. And it will if you click on it, it will tell you all the schedules, and that's where the most up-to-date information is on whether we have the vaccine, whether we have a shortage, and if there's any changes that will go on with the schedule. But our goal is to basically deplete our stock every single time we have any one of our vaccination clinics.
That's great. You have one coming up tomorrow in Selbyville, Bayside community, and then you have another one coming up this weekend, Sussex Academy on Airport Road in Georgetown. Sunday, you're in Frankfurt at the Frankfurt Fire Hall. And, you refer to constantly, it's a great way to spread the word about the 3 W's.
Yeah, I love calling it the 3 W's because it's such an easy way to remember. When I was in the Navy, I had the privilege of working with President George W. Bush, and the fingers that we use, the 3 W's. But it's wash your hands, wear a mask, and watch your distance. I think those are the things that really, at the end of the day, kept us to the point where we were able to flatten the curve. A lot of discipline went into that for the community. Very thankful to the community. And now, as we enter the fall and winter months, as beautiful as it is, my first fall here in Delaware, there's a tendency now to huddle together, to stay at home, to gather indoors. It's no longer being able to even physically distance at the beach, and so it really means that the thing we have to do is have more discipline about doing those 3 W's if we want to keep the coronavirus infection at bay.
Well, Dr. David Tam, thank you so much for joining us this morning on 99.1 Radio Rehoboth. People can go to bbhealthcare.org. David, it's always a pleasure speaking with you. We'll try to make it a little shorter in between our next interviews.
Well, Jeff, I hope that's true, because communication is one of our major weapons in fighting this pandemic. There's so much information out there, and Beebe Healthcare is focused on providing medically correct, scientifically driven information. So please look forward to talking with you. And Jeff, thank you so much for the work that you do every day in helping us and taking care of people.
Oh, you're quite welcome. And to everyone there at Beebe Healthcare, thank you for your great work, and please stay safe and healthy.
Thank you. Have a great day.
You too.